everyone, here's Nancy, the nurse practitioner, for a video for you today about how to take vital signs. My friend Maria here is going to help us, and I wanted to tell you that the main components of vital signs is checking for pain and the quality of it, checking oxygen saturation, which we'll go over, temperature, pulse, and respiration, and blood pressure. So the first thing we're going to talk about is about pain. Now, if you were with mom and she's alert and you were asking her, do you have any pain? If she could tell you, you want to ask her, Mom, where's the pain? Show me where the pain is. How long have you had it? Is it sharp? Is it dull? Does it come and go? What did you do to make it go away? And what makes it worse? So if you could record those 7 components, that will help you determine how mom's pain is doing, so you could tell her health practitioner exactly what's going on. There's also something that is used for people who can't speak, and this is a pain management scale. If you've ever seen this before, but it's smiley to sad face. And if you could see by this this actual guide, which I will put on my Facebook page for you guys to look at and you can download, the first one is a smiley face, shows it doesn't hurt. And the second one is just a little bit of a smile, and it says it hurts a little bit. And then the third one says it hurts a little more, and the mouth is just like, and then hurts more is the eyebrows start going down, and then hurts a whole lot. You're really starting to look sad. And then 10, which is the worst, is you're crying. So if somebody can't talk, but they understand you, you can ask these questions and you really get an idea of how bad their pain is, right, Maria?
I was demonstrating.
Oh, thanks a lot. Okay, so moving forward, the first thing we're going to do after that is to check oxygen saturation. Now, oxygen saturation is used with this little oximeter. It has a little cool little things you can put in your pocket. It can be bought at any pharmacy. You can get it online. It's made by many companies. And the first thing you want to do, and what it actually measures, is the fraction of oxygen saturated hemoglobin, not that that means a lot, relative to the total number. So a normal range for doing this test is 95 to 100%. That's what our oxygen when we breathe should be. If my patients get under 91, they get to 88, I start to worry that there's something else going on. Is it their respiratory condition that's causing this? Do they have anemia? What is the reason for their low oxygen? And over time, sometimes people have to go on oxygen if their level stays under 88%. So I'm going to demonstrate how to do this. The first thing you want to do if you're seeing more than one patient, which I see many of, is you take the finger of the person, usually the index finger, wipe it off with alcohol, because you don't want to use a device over and over again on somebody else that's been on somebody else's finger. It's just good cleaning. And by the way, before we really started, and this is my fault for not saying this, you always wash your hands before you touch a patient. You definitely wash your hands. You tell the people what you're going to do, and then everybody kind of cooperates. So just to back you up a minute, you need to wash your hands before you start. Okay? Maria agrees. So now that her finger is dry, I'll fan it off, you put the little oximeter on and you hit the button. Oops. And you're going to see these little like blue lines moving around trying to calibrate her oxygen level through her fingernail. And then it also checks her pulse rate, which is kind of cool. So she's at 98% oxygen, and she's adjusting down to 64 for heart rate. Real good, Maria.
Thank you.
Now, another thing that's really important to do is to record that. She was 98% and 64 heart rate. The heart rate we're going to also check another way, but this will help you at least have some starting point. So it's good to have a logbook for mom. Your day just started, and you're writing down in the logbook things that are going on. If you're going to check her vital signs, start writing them down. So now we have her pain level, and we now have her oxygenation. Okay? The next thing we're going to talk about is how to take a temperature. Now, temperature can be done in a number of ways. If the person is alert, you can use an oral thermometer. They look like this now. They're digital. They come with a little battery in them. Okay? And there's a little button on the end. before I go into this, some of us still have thermometers have mercury in them, and they're really environmentally not safe, and they really don't want them being in the environment anymore. So all you got to do, if you still have an old one from 30 years ago, which many of my patients who are 90 do have, put it in a little container, like a plastic bottle with a lid, fill it up with kitty litter or dirt, seal it tight, and you could actually throw it in the garbage. Did you know that, Maria?
I did not know that.
So, we're trying to keep the environment safe, but some of these tools are too old and they actually could break and the mercury gets everywhere and it's just a dangerous thing. So, got to get rid of those thermometers. So, we're going to use this nice digital thermometer I got. They run like $10 in the store. And if they break, you get another one. They do come with little sheaths that you could buy a little box. But since I'm going to wipe this one with alcohol, I can use it on my patient. And if it's mom, you could use it over and over again. So you don't have to really wipe it. You could. What you're going to do is if she's alert, you're going to ask mom to open her mouth. And then you're going to put this under her tongue. And you're going to actually wait till it beeps. She'll close her mouth around it. And we'll get a reading very quickly. So let me show you how to do that. Hit the button. It says 888 on the screen. It's ready to read. I wiped it off. Okay, mom.
I'm teasing you.
Open your mouth under the tongue, and she's closing her mouth around it. Hold the thermometer so it doesn't fall on the floor. And, tell mom it'll just take a second or two to get a reading. And it's gearing up. We're at 96.3. Wow, you're refrigerated, Maria. Okay. She's 96.3 oral. Now, what you want to write in your book is 96.3 oral. If mom can't close her mouth around it, like she's a mouth breather, consider doing an axillary temperature. So let's go over a couple things. First of all, an oral temperature, a normal measurement is between 97 and 99. Okay, but if you do an axillary, which means under the axilla or armpit, or it goes under your arm like this, that is actually 1 degree below an oral temperature. So now you're talking about 96 to 98. Okay, so you could actually do the same thing. You don't want to put it under a shirt. What you want to do is actually kind of stick it under her shirt, under her armpit like this, and get a reading. And you got to get the idea, right? Put it under the shirt, mom's nightgown, hold it under with her arm down, right to the skin, and wait for it to beep. And that reading will now be her axillary reading. Record it in her logbook as the reading, and then put axillary next to it. This way, the clinician you may call will say, wow, that's a low reading. And you can say, well, it was under the armpit. So the doctor will know, or the nurse practitioner, or the PA, all of us out here. Okay. So that's the second thing about thermometers. There's also something called temporal thermometers. And temporal thermometers is where it actually measures the temporal artery heat waves. And it actually involves starting at the top of the forehead. And I don't have a temporal thermometer because honestly, they touch the skin. And that means for patient to patient, I have to clean it. So I have a laser version. This one is from Viridan, really neat. They're about $70 though, and they're battery operated. They don't touch the skin. But let's go over the temporal one first. Same premise. You turn it on. You get a beep sound, and it goes from the forehead across, and the temporal artery runs right above the top of the ear. So you stop there, and it's going to start to, it didn't calibrate. But what I'm saying is if you have a temporal one that touches the skin, you would touch the skin after turning it on, go down to the side of the ear, and then you'll get a reading. Now, a temporal temperature is actually 0.5 degrees below than an oral. So you have to kind of calibrate that it's a little bit lower. But it's still accurate and good to use if you have no other way of taking a temperature. This laser one, like I said, is really cool because it actually follows the laser along the temporal and it doesn't touch the skin. So let's try this one again. It beeps. Let's use Maria. Go across the forehead. And hers was 94.6. So as we know, that's a degree below oral temperature. So she's really a little bit higher than that. And that's kind of like where she was measuring, somewhere in that. Okay, so far so good. Next, the temperature that may have to be done is a rectal temperature. Some of our people are confused, bedridden, not able to cooperate with any other temperatures. And rectal temperatures are easy to do. Again, you can use that oral thermometer we talked about. Doesn't have the mercury anymore, so we don't have to worry about breaking that bulb, God forbid, inside somebody. What you're going to do is tell the person to turn over on the side in bed. You're going to, of course, have their pants down. You're going to insert this thermometer just like an inch or a little bit in between the cheeks in the rectal area into the rectum. And you tell them what you're doing because it's not exactly pleasant and people need to know what you're doing so they cooperate. You've turned on your thermometer, you wait till the reading comes out, and you're going to get a reading for a rectal thermometer temperature. And a normal rectal temperature is usually 0.5 to 1 degree higher than an oral. Okay? A person is considered having a fever if their temperature is over 100 rectal, okay, and over 100.4 oral. So make sure you write down where this was taken, rectal, axillary, oral. Put the actual numbers down and put them in your logbook. Okay? Next thing we're going to talk about is how to check a pulse. A pulse rate is actually your heart rate. And let me just go through some of these. I'm sorry, we're not in order here. And a pulse is also called your heart rate, right? So your heart is here, right? Here's the sternum, the left breast here, and right around here is the heart. So if you're used to using a stethoscope and you're a nursing student or a clinician, then that's a great way to go. Checking someone's pulse is really easy. You just tell them, I'm going to check your pulse. They roll up their sleeve and you follow the thumb and go out, and there's actually a radial pulse here. On the other side is another pulse, and that's not the one you want. You want this radial pulse that runs along the thumb. With your index finger and your middle finger, never use your thumb because your thumb has a pulse of its own. Just kind of follow along till you feel the pulse. Now I know we're doing this kind of high because I want you guys to get to see this. But once I get her pulse, and another really important part of this is you will need a wristwatch from here on just to be counting. So have your wristwatch handy. You could also use your phone, but I have my wristwatch handy. So what you could do is actually take your left hand, whichever arm you're using, feel the pulse, look at your watch, and you can start counting. I usually wait till it's either the little second hand is on a 3 or on a 12, and then I count for 15 seconds. And it's easy to keep track of a 15-second beat. If it feels erratic or irregular, like you're hearing not bump, 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 but you're hearing ba-dum, ba-bum, ba-bum, this is not going to work unless you do it for a full minute. If you're not a clinician with a stethoscope, don't worry. Just do it for 1 full minute instead of for 15 seconds. But if it's regular, you're going to press down lightly. You don't want to press too hard because then you obliterate or you cut off the pulse and you can't count it. And then I'm just watching my watch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So Maria's heart rate is nice and steady. At 15, the pulse rate actually in 15 seconds was actually 15. You multiply it by 4, right? There's 4 sections of 15 in a minute. And now she has a 60 heart rate. And there you go. That's the pulse rate, 60. Now, if she was having an irregular heart rate, and a normal heart rate is between 60 and 100. Some people who are runners or are very fit have lower heart rates. Also, if you're on some beta blockers, it could lower your heart rate. So that could be a normal for you. It's called bradycardia when it's lower, and it's called tachycardia if it's over 100. Lower than 60 is bradycardia, over 100 is tachycardia. But if Maria's heart rate, if I felt her pulse and it was erratic, I could use a stethoscope. Now, a stethoscope is great. It has a bell and a diaphragm. All you need to do is put it in your ears. And what I do, and this is something even you as a layperson could do, is the heart is over here. You could actually feel the heartbeat. Right below the left breast area is the part of the heart that you could hear the beat. And I'm starting to count the same thing. 1, 2. I can look at my watch and follow it for a full minute. And that's only done if you found that the heart rate is irregular. You don't have to do that otherwise. Okay, so far, we're learning a lot of good things. The next thing is the respiratory rate. Respirations are important. If a person is breathing really fast, they may be in pain, or maybe they have other medical problems going on. They may have pneumonia. So there's things that you need to do by your heart rate and respiratory rate. It's really good to have this information. So a respiratory rate, people can actually change their respiratory rate if they think you're watching them. It's just a human behavior. So we're not going to say anything to Maria, but we're going to make believe we're taking her pulse. And after I've done doing the 15 seconds and I did it in my head and I counted for 1 minute's worth, I'm going to now just kind of look over at her chest, watch my watch, and every rise and fall of the chest is 1 breath. Okay, so she's laying in bed and I'm watching her chest rise and fall. That's 1 breath. Start at the 12 or the 3, whatever's easier, and count for 15 seconds. And make believe you're taking her pulse so she doesn't know that you're looking at her chest. When you get the reading, which is usually like 4, you're going to multiply it by 4 again, right? 15 seconds, 15, 15, and 15 make 1 minute. You multiply it by 4. So 12 to 20 is a normal respiratory rate. Okay, and write that in your logbook for mom. Okay, so the important thing that we're going to go over now is how to take a blood pressure. Now, blood pressure is really important to get accurate. I worked in many doctors' offices as a clinician, and I remember patients coming into the office, and they'd sit at the same table at the same side and give me the same arm. And then I would take it in the other arm, and I would find the high reading. And they might have been walking around with a high reading for a while, but nobody checked the other arm. So, really important to check both arms, find out which one is the higher reading, and that's the one you're going to go with. Now, there are some different types of blood pressure machines out there. I'm going to use a stethoscope only because I'm a clinician, and I will show you that. But there are large cuffs, which are really big. This is actually a thigh cuff because sometimes patients can't have a blood pressure in the arm, and you can take it in the thigh, but that's for another day, another story. But if a man or a woman are obese and you can't get a cuff around, you're going to need a big cuff. Okay, and this is a large one. If you don't have the right cuff on the person, you're going to get an abnormal reading. If the person is a skinny arm and you put a large cuff on, you're going to get a low reading. If you put a tight cuff on, then you're going to get a higher reading. So you have to have a cuff that fits the person. It's really good to either pull up the shirt, or if it's a thin shirt like Maria has, I actually tell people just leave it down, because otherwise it bunches up here and you get like a little bit of a higher reading. It's important to have their feet on the floor if they can. And you want to tell them, hey, did you have a smoke? Did you have coffee? Oh, she just had a cup of coffee. If you had Chinese food last night or shrimp or anything high, like, chips, it's going to raise your reading. And there's been a number of times I would say to my patient, oh my God, your blood pressure's high. Did you have Chinese last night? And they said, yeah, I did have Chinese food. So I always ask that, and it made me know they need to come back when they haven't had a high salt diet the night before. So we're going to put this cuff on her arm. Let's just go over, if I'm going to do the right arm, when you have a cuff and you buy it, it shows you right arm, left arm. It actually has a little arrow. You'll see that when you buy the cuff. And again, you can get these in any grocery stores now. Actually, not this kind of cuff, perhaps, not grocery stores, but pharmacies. There's a lot of places you can get them online. Okay, the way you put a blood pressure cuff on the arm is there is a brachial artery. It's an artery that actually comes down on the inside of the arm. This is where they check on babies too, to check their rate. So it's called a brachial artery. You could feel it pulsating. And that is where the cuff is going to have the arrow for the right arm, and the stethoscope is going to go right over that brachial artery. And I'm going to pump this cuff up to 180 or higher. And let's go over what we're reading actually. We are actually checking for the highest sound we hear as it's dropping and the lowest sound when it no longer is there. So the systolic is the top one. If I pump it up to 180 and I start going down, I'm going to wait till I hear the first sound, and then I'm going to keep going slowly by 2 to 3 millimeters. I'm going to open my little dial slowly till it gets all the way down to the last sound. The top number is the systolic, the bottom number is the diastolic, and that's the number you want to remember in your head. If you have to do it over again, wait a few minutes before you do that. And another important thing is positioning. You want to make sure the person's heart, their arm and wrist is at the heart level, like this. So I usually hold my patients, or if they're in the office, I put it on a table near me so I don't have to hold them. And this way, I'm able to get a good reading. The other thing about the cuff is you want to be able to get 2 fingers under it. And so there's a little room. That means the cuff works. You know, another thing I would need to show you is this little tiny cuff. I mean, look at how tiny this cuff is. Some of my patients are 80 pounds. This is a pediatric cuff, but it works on small people, little arms, and I get a real accurate reading. Okay? You saw the big one. This is like 1/5 the size, right?
Very
Tiny. Small. But I'll tell you, if you don't have the right cuff, you're going to get an abnormal reading. Okay, so we put the stethoscope on. We find the brachial artery. We're going to pump this up. She's at the heart level. We'll go up to 180. The little arrow is going up on the meter to 180. And we're going to slowly let the little wheel, which is on the bowl, out. Slowly, slowly. Till I hear the first sound. Okay, so I got 110. Wow, 110 over 50. That was the last sound I heard. And if you're not sure if that's accurate, you could do the other one too, and the higher number is the one you want. So this is the kind of apparatus that's used by clinicians. But for those of you who are not clinicians and you don't really want to be inaccurate, you could get one of these cuffs. They're called Omron. Many companies make them. And what they do is they do have some different size cuffs. This one does adjust. They're battery operated. And you don't need a stethoscope. So let's take this off so you can see. Basically, again, it comes with a little tube. That needs to go over the brachial artery, which we talked about is on the inner side of the arm, right above the elbow, the inside of the elbow, called the antecubital space there. Fossa, whatever. And again, she's going to hold it at heart level. And you're just going to turn on the button to turn it on, just like we do with other meters. And it tells you it's 0, and it's waiting for us to pump it up. Pumping it up. It even tells me when I have to replace the batteries. That's pretty nice. These things are great because they're close enough to accurate that you can get for people who don't know how to really take a blood pressure using a stethoscope. And it's important to bring this device into the doctor's office, your clinician's office, and make sure that they use it against their cuff so we make sure it's accurate. Otherwise, you may get readings that are way off and he's not treating you properly because your machine doesn't meet his device. Wow, this one's not working at all because I got 164 over 104. So obviously I used the cuff on her arm, which was right, and this cuff wasn't. So I would actually say I would bring this in and make sure it's right. Or maybe this is just getting old and it's time to get a new one. So you could see what a blood pressure of 164 over 103 would mean as opposed to 110 over 50. And that's a good example of why you need to have your blood pressure checked with the stethoscope and a blood pressure machine in a doctor's office to make sure it's accurate. Okay, so point well made, right? So make sure you bring your machine in with you. The other thing that I need to bring up is about wrist blood pressure machines, little wrist ones or finger ones. The American Heart Association doesn't recommend them because they found that they're not super accurate unless they're used exactly right. And that means positioning has to be exactly where the arm is above the heart and in the, and everything, the wrist as well. And if it's not done right, you're going to get readings all over the place. So it's not one of the best tools to use. If you have no other device available, you can bring it into the office, let the cuff be checked there with a stethoscope, try your cuff, your little wrist one, and see if it's accurate. Okay, and if that's the only way you can do it, then that's it. So we went over temperature, pulse, respiration, we did oxygen, and we checked also for pain. Until the next video, thank you for joining me. Take care.